Outbreaks are inevitable, but catastrophic losses for sexual and reproductive health are not. Tweeted International Planned Parenthood Federation. Imagine being 9 months pregnant and no hospitals ready to admit you. Imagine being a child forced to live with an abusive family member. Imagine being a woman locked up with a sexual predator. No, these are not hypothetical situations. These are the present conditions of more than half of female population of this world. And today, as part of celebrating World Population Day, I would like to talk about awareness of women's and girls' needs for sexual and reproductive health and the vulnerabilities during the pandemic through this very new episode of Creative Lounge. Neelam, an 8 months pregnant woman, died here in Uttar Pradesh very recently. She was taken from one hospital to another, pleading them to admit her. After a 13-hour hospital hunt, she succumbed to death in an ambulance. No hospital was ready to admit her because of the pandemic. In a very similar event which happened in Maharashtra, another pregnant woman died in an auto rickshaw after several hospitals denied her admission. These incidents are not confined to India alone. This pandemic has set forth a whole new plethora of problems relating to sexual and reproductive health of women and girls around the globe. As per a news report given out by The Hindu, between 25th March and 31st May, 1,477 domestic violence cases were reported here, which is the highest recorded during this time span in the last 10 years. And this is not the scariest part at all. As per the report, almost 86% of women who experienced mental and physical violence never sought help. This makes the 1,477 domestic violence cases reported just the tip of an iceberg, an enormous iceberg lying underneath. In a society which still considers menstruation to be taboo and have not yet acknowledged females as sexual beings, awareness towards sexual and reproductive health of women and girls should be of prime concern regardless of a pandemic status. But the fact that this pandemic has absolutely increased their vulnerability is an unfortunate truth. Awareness regarding sexual and reproductive health among women and girls are extremely scarce even in this era. The use of a sanitary napkin is still modern and unknown to numerous women around the globe. The right to have a say in pregnancy is something alien to many women and girls. And girls who have not yet lost childhood from their eyes are forced into motherhood with an unprepared body and absolutely no knowledge about sexual or reproductive health. And an unprecedented pandemic makes the situation a whole lot worse. How many girls we know could walk into a store and buy a sanitary napkin without hesitating at least once, or without receiving the stigmatized glance of those around her? How many women we know would go and buy a contraceptive without being judged? Since time immemorial, anything related to female sexual and reproductive health have been categorized as shameful and bad. Our society has always taught us that anything related to menstruation is to be whispered that abortion is the greatest of sins, and even uttering the word sex is forbidden for women. Almost every woman, regardless of class, caste, age, or color or race, would have experienced sexual encroachment in one way or the other during their lifetime. None of us can confidently say that this society has ever given enough importance to female sexual and reproductive health. With the advent of this pandemic, every woman and girl who were physically abused or sexually abused by their intimate relations are now prone to 24/7 violence with no schools or workplaces to go to. Every mother who teaches her daughters to adjust, and every father who threatens his daughters to be good wives are all culprits for the huge rise in domestic violence cases which are left unreported. Every year, some 4 million teenage girls in India gives birth. Now imagine the same happening without proper medical attention. In addition to this, access to hospitals have become extremely difficult due to the pandemic. How many more Neelams are to die in our society? While staying comfortably at our homes, have we ever thought about our female migrant workers and how they would be managing their menstrual needs? Managing menstrual hygiene during traveling is a huge hurdle, that too without access to any basic needs. They have to travel about several kilometers in India in order to relieve themselves, and that too in open spaces. These add to the risk of catching contagious diseases. It was never easy for women to paddle through the social boundaries. Their sexual and reproductive health have always remained in darkness, just like them. And if this pandemic is adding on to their sufferings, we can at least lend a hand in order to help them survive. Hotlines and shelters are of great help in rehabilitating women and girls from abusive households. And measures like Mask 19 implemented by a local government in Spain and other rescue measures which can help survivors of sexual and gender-biased violence needs to be appreciated and extended in order to gain momentum. Show empathy, listen to them, validate their experiences, enhance their safety, reach out in need. We need to change our social fabric in order not to stigmatize women any longer. We need to let them know and practice their sexual and reproductive rights. We need to be equipped enough not to let another Neelam die. Pandemic or not, every child born as a female has every right to its sexual and reproductive health. Do not let the society decide otherwise.